Hello, my name is Olivia Staples. I'm a nursing student at the University of South Alabama, and today I'll be performing the NG Tube Insertion Checkoff. Just going to scan the room. So the first thing I'm going to do upon entering the room is perform hand hygiene. I'm going to verify hospital policy as well as the patient's order then I'm going to use two identifiers to identify my patient. I'm using the patient care order form as well as his armband. I see his name is Jaguar Jones, date of birth 8/25/1923, 8/25/1963. I'm going to assess his allergies. He is allergic to penicillin and is labeled on his armband. Now I'm going to explain the procedure to the patient as well as provide privacy. Now I'm going to gather all my equipment. I have my stethoscope as well as my pen light and tongue blade. I am going to put on my goggles and perform hand hygiene. I'm going to raise the bed to a working height, lower the side rails. I am going to then assess the vital signs, O2 saturation, and listen, also to the bowel sounds. I'm going to clip the pulse oximeter to the patient's index finger, and if there were a decrease in oxygen saturation and or deterioration in vital signs, I would stop until the patient's stability was determined. Now I'm going to raise the bed to high Fowler's position, and I'm going to then come up with a cueing sign with my patient to let me know when I need to stop, so I would tell them to raise their finger. Now I'm going to open my pump. I'm going to lubricate. Now I am going to mark the piece of tape. First one I'm going to do the dog tape, and this one is going to be to measure my tubing. My next piece of tape is going to be used to secure the tubing to the patient's cheek. This one is going to be to label it. And then the last one is going to be for final fixation. Now, I am going to make sure my plunger works. I'm going to loosen it up, and I'm going to put on my gloves. Now that my gloves are on, I'm going to check my patient's patency. I'm going to do this by occluding one nostril, having them breathe in and out, including the other nostril, having them breathe in and out. Now I'm going to clean the bridge of their nose, and you can do this with soap or water or a alcohol swab. So I'm using an alcohol swab to clean their nose. Discard of that. And now I'm going to be measuring the tubing. So normally on a real patient, I would make sure that they weren't wearing any clothes, but for today, she will be. So I'm going to measure from the nose to the earlobe, and the earlobe to the xiphoid process. And this is at 50. So now I'm going to mark this with my tape. And I'm going to place the towel as well as basin the patient's chest. Now I'm going to coil my tubing, and this is just to loosen it up so it's not so stiff for my patient. patient. Now, I'm going to lubricate the first 4 inches of my tubing. And now I'll begin inserting into my patient's nose, and I'm going to instruct them to tilt their head back against the pillow, and I will push with the curved end downward. And then once I meet the nasopharynx, I will encourage the patient to move their head forward and relax, and I'm going to encourage them to swallow, or I'll have them sip water, dry swallow, either or. And I am going to advance it 1 to 2 inches, twisting at a 180-degree angle. And I'm going to make sure that I do not force against resistance. I'm going to keep telling them to swallow. And then if the patient were to cough, or if there were a drop in O2 saturation, or they went into respiratory distress, I would then pull back and to the nasopharynx, and I would have the patient take deep breaths, and I would have them swallow before advancing any further. Now that I've reached the placement mark, I'm going to secure the tape to the patient's cheek. I'm going to do this, making sure there is slack. I'm going to get a piece of my tape, secure it to the cheek. And now I'm going to check for a correct position using my pen light as well as tongue blade. So I would just have the patient open their mouth, and I would lower the tongue, making sure I could see it in the back of the throat. Now I am going to also check for correct placement by attaching my syringe. And I'm going to be aspirating gastric contents, and I can also check the pH as well as have an x-ray order if need to. Now I am going to secure my tubing. I'm going to remove the placement mark. I am going to then clean the bridge of the nose again using an alcohol swab. I'm going to secure the bridge of the nose to the tube, making sure there's slack, just make sure there's not any pressure. And I'm also going to label on top of the bridge of the nose. Then I'm going to remove the tape from the cheek and clip it to the patient's gown. Now, I would have the patient turn their head back and forth, making sure it's not too tight. I'm going to use an indelible marker to note the exit site to guide me for tube displacement. I'll do that there. Now, I'm going to check for suctioning, and if I were going to be, I'm going to be using this. I'm going to replace this. And then I'm going to be using this straw as my suction tube, so I would just attach this and turn on low law and 1-minute suctioning. Then I'm going to remove that. And now I'm going to demonstrate capping. I would just put the blue pigtail back on it, and I would have this above the patient's stomach at all times. So I'm going to keep this at the head of the bed. Now I am going to lower the bed back, the head of the bed back to 30 degrees. I'm going to raise the side rails, lower the bed to the lowest position, make sure the patient is comfortable, and make sure that the call light is on. I am going to discard all my equipment. And then I'm going to I'm going to remove my gloves and perform hand hygiene. And now I'm going to document. I document the type and size the type and size, as well as the time, the location, whether it was the right or left nair. I'm going to document how it was secured, how the placement was verified, as well as whether suction was used. I'm going to document how the patient tolerated the procedure and the amount, color, and characteristics of the secretions. Now I'm going to begin discontinuing the NG tube, and I'm going to do this by first checking the patient's order form, and then I am going to place the towel right here. I'm going to perform hand hygiene, and I'm going to put on my gloves. And I'm also going to be sure to explain the procedure to the patient. Now, I'm going to, first I'm going to auscultate for bowel sounds, and then I will turn off the suctioning, and then I'm going to remove the tape and remove the clip as well as the tape from the patient's tubing. And then I am going to encourage the patient to take a deep breath and hold it. And then I'm going to remove the tubing as I'm keeping it on its. Now I'm going to discard everything. I'm going to remove my gloves, perform hand hygiene, and I would document the amount of drainage as well as provide oral care, and then I would document. Thank you.